Hello everyone, welcome to Eagle Health. I am Dr. Sunil Apsinghi, consultant orthopedics at MaxCure Hospitals. So today we shall discuss about this very common thing. Why do young people get knee pains? Why do young people, especially women, when you see them in their 20s, 30s, 40s, they start getting this knee pain which is very severe. That is, they can't sit down, they can't stand up, they can't climb stairs, squatting is problem. Surprisingly, walking is not that big an issue. These other things are more painful. So, whenever we consider joint pains in young people, there are a few things which we should make clear. One is it something what we call inflammatory arthritis? That is something like rheumatoid arthritis or arthritis associated with other autoimmune conditions. These have to be ruled out. And more commonly, these are associated with other joint pains like hand pains, pain in small joints of hands, feet, in shoulders, and other joints. And in generally, these patients are more disabled than what the kind of patients whom we are going to talk about. These patients need a different evaluation with the rheumatologist and make sure that there is no rheumatological condition. So when we come to these particular subgroup of patients who have severe pains in their knees, and this pain is very typical. It is associated with squatting, with standing up from a sitting position, with climbing up and down the stairs, or sitting with their legs folded, like you sit in a bus or you sit in the back seat of your car, where you have to really bend your knees and then sit. And getting out is painful. Sitting like that for long duration is painful. This, my friends, is not a very dangerous condition and doesn't lead to any kind of arthritis. This is a condition which we call chondromalacia patella. That is, as you know, this is our knee, the structure of our knee. This is the thigh bone, this is the leg bone. In between we have the kneecap or the patella. This is the kneecap. All our bones inside the joint are lined by what we call cartilage. Cartilage is the smooth substance which makes sure that our joints glide and there is no friction. When the cartilage is gone, the joint becomes arthritic. In chondromalacia, nothing like that happens. What happens is the cartilage on the back of the kneecap becomes soft, and we really don't know why it becomes soft. At present, the science can't explain why it becomes soft. All we know is it becomes soft, and that becomes painful. As you can see from here, if this is the bit that has become soft and painful, whenever you bend the knee, there is a lot of contact pressure between the kneecap and the thigh bone. This contact pressure causes pain. So whenever they do any activity where they bend their knees, like squatting, climbing stairs, or hopping on one leg, whenever there is pressure which builds up behind this kneecap, this causes pain. And whenever they stretch their leg, keep their legs straight out, then they feel fine. Most of these IT people, they can't sit with their legs bent. They have to stretch their legs out and they feel better. So this is what we call chondromalacia patella. What do we do for them? First is we evaluate them clinically, look at them, see where is the pain, see where is the tenderness, and then get some x-rays done. Normally x-rays are normal for them. What about MRI scans? Yes, we do get them, but it's not very frequently. We don't get them at the first episode. We wait for some time, wait for it to get better. If it doesn't get better, or if someone's suffering for 8 to 9 months, then we get an MRI scan done. What is the treatment for this condition? The treatment is normally, number one, reassurance. These people are worried that they are getting arthritis. They are worried that they are becoming old at the age of 25, 30, 35. They need reassurance. We need to tell them, no, this is not the problem. You are going to get better. It's only a temporary phase. And the second thing is a bit of painkillers, just to take care of the severe pain, and then physiotherapy. Improving your quadriceps muscles does help. Things like cycling are good. Things like jogging, running, jumping are not good for your knee when you have this condition. So you need to improve your quadriceps and give it a bit of time. More often than not, this condition settles by itself. So my dear friend, if you're young and are having knee pain, don't be worried. It's very likely that you are not having arthritis. It is more likely you are having something like a chondromalacia patella, which gets better with time. Thank you.
Like and subscribe Eagle Health and Beauty.